هنتكلم على الابديتس بتاعت اللون كانسر في 2022. من اهم الستاديز السنه دي هي البيرلا 2 study. هي phase 2 study which is a very interesting design because it's actually comparing two immunotherapies plus chemotherapy versus each other. الدوستارليوماب plus chemotherapy, البيمتريكسيت plus البلاتينum versus البامبريليزوماب plus البيمتريكسيت and platinum. This is a very interesting design لأنها دي أول study على الرغم إنها phase 2 study بس it includes أكتر من 260 عيان. So it's relatively big and it's directly comparing two immunotherapy in first line of non-small cell lung cancer and non-squamous component of it. Interesting is the finding of the study where we find that the dostarlimab has a superior median progression-free survival of 8.8 months versus only 6.7 months for pembrolizumab plus chemotherapy. And also on the objective response rate, the objective response rate with dostarlimab plus chemotherapy was superior to the pembrolizumab, 46% versus 37%. However, when we go into the positive PD-L1 expressors, this include 1 to 49% and above 50%, we'll find that the positivity of the dostarlimab versus pembrolizumab was 50% versus 37% for the pembrolizumab. So this study gives us an option of dostarlimab plus chemotherapy in first-line non-small cell lung cancer with no driver mutation with superiority in comparison to pembrolizumab. Another interesting study that have been published in 2022 is the LongMap S1800A. So the study evaluated the second-line choices in non-small cell lung cancer after progression on immunotherapy as a first line. The study has two arms. One arm, which included the investigator choice, with a standard of care that can include docetaxel or gemcitabine or docetaxel plus ramucirumab. The experimental arm was pembrolizumab plus ramucirumab in 1-to-1 formulation. This study actually turned out to be positive with a superior outcome for pembrolizumab plus ramucirumab with a median overall survival of 14.5 months versus 11.6 months for the standard of care, with a hazard ratio of 0.69 and p-value of 0.05. One of the interesting studies published in 2022 is a Checkmate 816 study. This study was quite interesting because it tackles the question of the usage of neoadjuvant systemic therapy before resection of non-small cell lung cancer in stages between stage 1B into stage 3A. This study was a phase 3 randomized study, open label, for two arms. One arm is chemotherapy alone versus chemotherapy plus immunotherapy nivolumab for only 3 cycles. And the outcome of the study was quite interesting with a superior median event-free survival for the immunotherapy nivolumab plus chemotherapy versus chemotherapy alone of 31 months versus 20 months alone for chemotherapy. That giving a superior 11 months gain in event-free survival with the addition of 3 cycles of nivolumab in the every 3 weeks dosage, 360 milligrams. Another thing was quite interesting was the pathological complete response, because the pathological complete response achieved with immunotherapy, nivolumab plus chemo, was actually 24% versus only 2% with the chemotherapy alone.